Namaste, I am JP and Dr. Priyanka BAIRWA from Faculty of Physiotherapy and Diagnostics. Earlier, I had made first part of the neurological investigations in which I had included the CSF analysis. Now it is the part 2 ahead of neurological investigations. So let's start. In this video, first topic I include electroencephalography. When the eyes are shut and the most obvious frequency over the occipital cortex is 8 to 3 seconds alpha rhythm. This appears when eyes open. Other frequency band seen over the different parts of the brain in the different circumstances are beta, faster than 13 per second, theta, 4 to 8 per second, and delta, slower than 4 per second. Lower frequencies predominant in the very young or during sleep. Indications: evaluation of suspected epilepsy, classification of seizure disorders, assessment and prognosis of seizures, diagnosis of certain neurological disorders like the herpes simplex, encephalitis, Creutzfeldt Jacobson disease, or subcutaneous sclero subcutaneous sclerosing encephalitis. Evaluation of alternated consciousness. Then normal ECG and abnormal ECG. This is the normal ECG and this is the abnormal ECGs. Next topic is electromyography and the nerve conduction studies. Indications: the distinction between disorders primarily to nerve or to the muscles, neuropathy versus myopathy. The distinction between root or plexus involvement and more distal nerve trunk involvement. The distinction between generalized polyneuropathy processes and widespread multifocal nerve trunk involvement. The distinction between upper and lower motor neuron weakness. The distinction in a given generalized polyneuropathy process between primarily demyelinating neuropathy and primary axonal degeneration. The assessment in the mononeuropathies of the site of the lesion and its major effect on nerve fibers. Spatially, the distinction between demyelinating conduction block and the Valerian degeneration. The characterization of the disorder of the neuromuscular junction. Imaging. The technique available for the imaging the neuron system, computed tomography, used for diagnosis of stroke, tumor, trauma, SAH, and dementias. Magnetic resonance imaging, diagnosis of stroke, tumor, trauma, SAH, dementias, multiple sclerosis, infections. Diffused weighted magnetic resonance imaging, perfusion weighted magnetic resonance imaging, progesterone emission tomography, single photon emission computed tomography, functional magnetic resonance imaging, magnetic resonance spectroscopy, magnetic resonance angiography, CT angiography, plain X-ray, myelography, ultrasonar, ultrasonography. This is the right middle cerebral artery infarction. In this image, you can see left temporal tumor. In this images, you can see multiple sclerosis, carotid part around the basal ganglia. Next is biopsies. First is brain biopsy. Biopsy of the brain tissue can be useful in a certain cases when the less invasive methods, such as studies, fail to provide a diagnosis. Brain lesions most amenable to biopsy are those that can be localized by imaging studies, are situated in the superficial, surgically accessible sites, and do not involve critical brain regions such as the brain stem or the area of the cerebral cortex involved in the language or motor function. Used for primary and metastatic brain tumors, infectious disorders such as herpes simplex encephalitis or brain abscess, and certain degenerative diseases such as um, Ritwis-Jacob disease. Muscle biopsy. Histopathologic examination of a biopsy specimen of a weak muscle can indicate whether the underlying weakness is neurogenic or myopathic in origin. Examination of a muscle biopsy specimen may also permit certain inflammatory diseases of the muscle, such as polymyositis, to be recognized and treated. Nerve biopsy. Evidence may be found of the metabolic storage diseases, for example, Fabry disease, Tangier disease, infection such as leprosy, inflammatory changes, vasculitis, or neoplastic involvement. Artery biopsy. In patients with the suspected giant cell arteritis, temporal artery biopsy may help to confirm the diagnosis. Thank you. This video is powered by digital version of 2.0. If you have any concern and questions regarding to this video, you can comment in the comment box. Namaste. Khush rahiye vidya.